Hello everyone, and thank you for your interest in this topic. My name is Sara Brown, and I am a genetic counselor at ARUP Laboratories. The title of my talk today is Utilization Management and Beyond, the Many Roles of Genetic Counselors in the Lab. In this talk, I will start with a brief description of what a genetic counselor is, as this is a relatively new and rapidly growing field. I will spend some time reviewing the current literature on the subject of genetic counselors and test utilization management, and then close with some examples of additional ways in which genetic counselors' skills can be applied in a genetic laboratory setting to optimize patient care. To start us off, genetic counselors, or GCs, are healthcare professionals with specialized training in both genetics and psychosocial counseling. The first training program specifically formed to prepare students for genetic counseling as a profession was established in 1969, and there are now 33 master's degree programs accredited by the Accreditation Council for Genetic Counseling in the United States. Graduates of these programs are eligible to take the board exam administered by the American Board of Genetic Counseling, and there are currently 19 states and counting that require licensure for practicing genetic counselors. The unique combination of medical genetics knowledge and counseling skills equip genetic counselors with the expertise to explain complex genetic concepts in understandable terms, provide psychosocial support related to genetic diagnoses, and assess an individual's genetic risk based on personal medical history, family history, test results, and other relevant factors. There is a longer list of specific practice-based competencies required of genetic counselors, but in general, these are the major skills that GCs use in practice. The National Society of Genetic Counselors is a professional organization for GCs in the United States. NSGC conducts a biennial professional status survey of practicing genetic counselors to collect data about work environment, salary and benefits, job satisfaction, and other measures. The most recent survey, published in early 2016, showed that GCs are working in an increasing variety of specialty areas and settings. The major areas include cancer clinics, prenatal practices, and pediatric genetics clinics. But other specialized areas have grown in recent years, such as neurogenetics, cardiology, and laboratory settings, among others. NSGC professional status surveys in recent years have shown an increase in the number of genetic counselors who work for laboratories, as opposed to clinical settings. These settings include commercial genetic testing companies, academic or reference labs that perform genetic testing, in-house laboratories for local hospitals or health systems that send out genetic testing, and more. The specific duties of these GCs vary among laboratories, but the bottom line is that a genetic counselor's knowledge and skills that are typically used in a clinical setting, meeting with patients directly, can also be aptly applied to laboratory support roles related to genetics. For example, skills implemented by clinical GCs to establish rapport and explain genetic information to patients can come in handy when tactfully discussing an inappropriate genetic test order with the ordering clinician. GC counseling skills, including reflecting, reframing, and redirecting, are useful in many customer service situations, and effective use of closed or open-ended questions by clinical GCs used to elicit information from patients can also be used by lab GCs to gather clinical information from clinicians to aid in genetic test interpretation. While psychosocial skills taught in GC training programs are usually patient-focused, genetic counselors who find themselves in laboratory support roles are well equipped to apply these same skills in a different setting. In today's healthcare environment, one area of widespread recent interest is utilization management, or UM. This term refers to evaluating the appropriateness of healthcare services, taking into account medical necessity and cost, as well as evidence-based guidelines. Utilization management in the context of laboratory medicine involves implementing strategies to ensure that laboratory tests are ordered, run, and interpreted appropriately and accurately. ARUP is one of many organizations that actively supports laboratory test utilization management initiatives. Genetic testing is one area of laboratory medicine that can especially benefit from UM programs, as complex genetic tests tend to be more expensive than most other lab tests, often have a longer turnaround time, and typically genetic testing doesn't need to be repeated on the same patient. Thus, misordered or duplicate testing has the potential to result in significant unnecessary costs to patients and the healthcare system as a whole. Through a variety of mechanisms such as assisting with genetic test orders, review of send-out genetic tests at local institutions, and pre-test review at the performing laboratories, genetic counselors in laboratory roles can improve costs and patient care by reducing unnecessary or inappropriate genetic testing. Although the pool of data is still small compared to other GC specialties, there is a growing body of literature documenting the roles of genetic counselors in the lab and the impact of GCs on test utilization management, especially in regards to cost savings. In 2008, Scaccieri and colleagues described the role of genetic counselors specifically in molecular genetic laboratories. They demonstrated how laboratory-based genetic counselors can assist clinicians with understanding the complexity of genetic testing and growing number of test options available. This may involve pre-test consultation with the clinician to ensure the most appropriate test is ordered, as well as post-test consultation with the clinician to discuss complex results. The Lab GC is not only a resource for the clinician, but is also an advocate for the clinician and their patient throughout the testing process by facilitating communication between the clinician and laboratory. Scaccieri also described some suggestions to clinicians to help optimize this process when working with a Lab GC. In a white paper released by my ARUP GC colleagues in 2011 and later published in 2014, Miller et al. Presented data showing that 26% of genetic tests reviewed by GCs at ARUP required order revision, resulting in a savings of $1.2 million to ARUP's clients in the 21-month period for which data was reviewed. Examples of order revisions included changing a full gene analysis to targeted testing for a known familial mutation, replacing multiple individual tests with a more cost-effective panel, or performing multiple tests in a stepwise fashion instead of concurrently. In a 2013 paper by Kotzer et al., they described that genetic test utilization management involving genetic counselors saved approximately $194,000 in a 3-month period at the Mayo Clinic through cancellation of duplicate orders and revision of misordered tests. Dickerson and colleagues in 2014 showed a savings of approximately $119,000 in an 8-month period at Seattle Children's Hospital, during which 251 cases met criteria for review by the committee. Riley et al. In 2015 described strategies, including decision support tools implemented at the Cleveland Clinic, which saved approximately $27,000 per month, and genetic test review by a genetic counselor and molecular pathologist, which saved approximately $29,000 per month. So overall from these papers, it is clear that test utilization management for genetic testing has great potential to save healthcare dollars. And importantly, while the cost of the genetic tests themselves are fairly easy to quantify, the downstream effects of optimizing genetic test orders are harder to measure, but certainly may be greater in scope, both financially and in terms of a patient's quality of life. For example, identifying a specific diagnosis through appropriate genetic testing earlier rather than later in the diagnostic odyssey can potentially preclude the need for additional testing or clinical evaluation, resulting in saved healthcare dollars and improved care for the patient. Identifying a genetic diagnosis may also lead to additional tests or screening that could decrease morbidity and mortality. As an example, this is often the case when genetic testing reveals a hereditary predisposition for developing cancer in an asymptomatic patient. The sense of positively impacting patient care through test utilization management is a common source of job satisfaction for many lab genetic counselors, including myself. But is not the only way to utilize genetic counselors in the lab, which you can see from the tables in these 2 papers, the first of which was published in 2012 and the second in 2016, which both describe laboratory genetic counselor roles. Let's take a look at some of these specifically. One of the most prevalent roles that I've already mentioned briefly is that of laboratory customer support. Genetic counselors are able to discuss specific cases with ordering clinicians to help with optimizing genetic testing strategy, explaining test results and recommending further testing for patients or family members, or handling case management for complex or sensitive cases. GCs can answer questions about the various genetic testing options, including the sensitivity and specificity of testing, the methodologies used, and the limitations of the test. Some lab GCs are also involved in billing or insurance preauthorization for genetic tests as well. Overall, lab GCs are well suited to act as liaisons between the laboratories and their clients. Another way in which GC expertise is used by laboratories is in customized report writing. Genetic test results are often complicated and reports can be pages and pages long. Because of their skills in explaining complex genetic concepts in understandable ways, some lab GCs are involved in report writing and customizing reports to fit the specific patient's clinical findings, family history, and results. In addition, genetic counselors can help laboratories with new genetic test development. GC expertise can be useful when deciding which tests to bring online and how to offer tests in clinically useful ways. Some lab GCs use their clinical experience to assist with development of client-facing genetics content for websites or marketing materials. This list is by no means exhaustive, as you saw from the previous slide, and as more and more genetic counselors are employed in lab settings, labs will find additional ways to use GCs. So to summarize, while genetic counselors are clinically trained to educate and counsel patients face-to-face, those skills can transfer very well into the laboratory environment, and there is great potential to positively impact patient care. Lab GCs are involved with test utilization management with demonstrated cost savings, as well as other benefits. And finally, genetic counselor skills are utilized in other areas beyond that capitalize on GC expertise for the benefit of patient care. And with that, I will end this talk. Thank you for your attention.